Hi, my name is Noemie, and I'm a second year medical student working for CIME. And today I'll be talking to you about nutrition during pregnancy. Having a baby can be a wonderful experience, but it can also be a time of uncertainty. Many parents have questions and concerns as they face all the changes that pregnancy brings, and having accurate information is so important. It will help you to make good decisions about how to take care of yourself before, during, and after pregnancy. So, eating well during pregnancy and during lactation will make you feel better and give you energy to go through your day. It will also help you gain a healthy amount of weight, which is important to prevent any complication and to support a good pregnancy and even a good lactation. Also, it will contribute to your baby growth. As you know, your baby starts growing in your uterus, and what you eat and the nutrients you get will affect him as well. So it's important to provide our baby with healthy food and prevent harmful chemicals like caffeine, smoking, drugs, and alcohol. Your weight gain, what weight you should gain really depends on the weight you had pre-pregnancy. So typically, most people are in healthy weight. Therefore, throughout the whole pregnancy, they need to gain between 11.5 and 16 kilograms. The lower your body weight and body mass index is, the more weight you need to gain. This will include infant weight, the weight of your breasts, the weight of your uterus, and the fluid accumulation, and also some fat stored to help during the breastfeeding. So normally you should gain about 1.5 kilograms in the first 4 months of pregnancy and 0.5 kilogram per week in the second and third trimester. So how much more should you eat? It's really a myth to think that you should eat for two during pregnancy. So during the first trimester, you don't even need more energy. So you should eat as you ate before. And then during your second trimester, you should have an increase of about 340 calories per day. So that's about one snack. And then during your third trimester, you should have an increase of about 450 calories per day, which is about 1 to 2 snacks. So you should never think that you should eat 2 meals all the time. And your extra calories should come from nutritious food, so from lean meats, low-fat dairy products, fruits, vegetables, whole grain bread, and cereals. So fluids, you should drink more fluid when you're pregnant. So drink approximately 12 cups of water or other beverages like milk throughout the day. You should avoid excessive caffeine drinks like coffee, tea, energy drinks, and cola. And you should also avoid some herbal teas. So, for example, chamomile is not a good drink when you're pregnant. And you should also avoid teas with aloe, coltsfoot, juniper berry, pennyroyal, buckthorn bark, comfrey, Labrador tea, sassafras, duckroot, lobelia, and senna leaves. There are other herbal tea that are safe to take in moderation, like citrus peel, linden flower, ginger, lemon balm, orange peel, and rose hip. So these are safe if you take about 2 to 3 cups a day, but the other ones before, you should not really take them during pregnancy. So important nutrients during pregnancy. So iron is very important for healthy blood. It is also needed for your baby's brain to develop properly. So you should get enough iron so your baby can grow properly and build up a good store of iron for after the birth. You also need calcium throughout your pregnancy to build strong bones and teeth for your baby. And finally, vitamin D is also needed to absorb and use the calcium. So getting enough calcium will also help your teeth and bones stay healthy too. So to get this good calcium, you should take enough calcium through with your food and vitamin D as well. So a typical meal. So you should always have fruits, vegetables, grains, meat, and alternative, and dairy. So for fruits, you should get 2 cups or more fresh, frozen, and canned fruit, and limit juices to 100%, 1 cup per day. Vegetable, 3 cups or more fresh, frozen, or canned vegetable. grains 5 to 7 ounces from grain like bread, cereal, and pasta, and at least a half from whole grain. So you should choose your products with whole grain preferably, and you should also choose products with fortified with iron, so that you get enough iron through your meals. For meat and alternatives, so you should take 5 to 6 ounces of beef, chicken, fish, legume, eggs, tofu, or nuts. And for dairy, you should have 3 cups per day. So either low-fat yogurt, fat-free or low-fat milk, reduced fat cheese, or cottage cheese. So for an example of proteins that you could take, if you don't want to, if you're lacking inspiration, so you could take cooked beans, nuts, and seeds like sunflower seeds, almonds, hazelnuts, pine nuts, and peanuts. You could take lean beef, chicken, shrimp, clams, oysters, crab, halibut, cod, and herring, yellowfin tuna. So for the conversion, for 1 ounce of meat, you need 1 large egg, or a quarter cup of tofu, or a quarter of a cup of cooked beans, 1 tablespoon of peanut butter, or half an ounce of unsalted nuts. So all of these equal to the same amount of proteins. So what should you avoid during pregnancy? So for fruits and vegetables, you should avoid unpasteurized cider or juices. For meat, fish, and poultry, you should avoid raw or uncooked meat. You should avoid high mercury containing fish, so you should not take more than 12 ounces per week of fish that contain high amounts of mercury, like salmon. And you should avoid deli meats unless they are heated. So that includes hot dogs, luncheon meat, other deli meats, unless you heat until they are steaming. And for the dairy products, you should avoid raw or unpasteurized milk, cheese, and dairy products. And you should also avoid soft cheeses like brie or blue cheeses. So you might notice that during pregnancy, you'll experience morning sickness. And that is very more important usually during the first trimester. So, and that all happens because of changing hormones. So certain smells and movements can make the nausea worse. And the good news is that usually the nausea disappears after the first trimester. So these are little tricks that can help you get enough nutrition during these phases of morning sickness. So you should try to eat 6 small meals or snacks during the day, because small meals may be easier to tolerate than large meals. You should keep easy to digest foods such as crackers or pretzels with you during the day and at your bedside. And you may even try eating a few crackers before getting out of bed in the morning, so that you don't experience too much morning sickness. You want to drink water or other beverages between meals. And of course, these beverages should be caffeine-free. You can eat ginger because it might improve the nausea, and lower fat foods are easier to digest. So high fat foods can make the nausea worse. And you might also notice that you might experience heartburn during your pregnancy. So these are a few tricks to help you. So you should not lie down after eating. You should avoid fried or greasy foods. You should drink fluids between meals and not with meals. You should avoid coffee, colas, alcohol, and smoking. You should eat slowly, so take the time to chew well, and eat small meals and snacks. And when you do lie down, you could put pillows beneath your head and shoulders so that you are more raised, and that might help with the heartburn. So pregnant women can enjoy the benefits from exercising. So the benefits of exercising, it can reduce some of the previous complaints like nausea, like heartburn, and it can also improve mood and sleep, and it can help during labor and recovery. So these are a few tips and tricks that you should follow during your pregnancy while exercising. So you should start easy and progress gradually. So if you've been inactive, start with mild activities like walking or swimming. Even 5 minutes a day will help. Gradually increase the time you're active to 30 minutes a session. Before starting a new physical activity program, you should talk to your healthcare provider just to make sure that it is safe for you while pregnant. and you should not overdo it. So you should be able to carry a normal conversation during physical activities. If you're feeling more tired than normal, take it easy and rest for a day. Keep cool and hydrated, of course, and drink lots of water before, during, and after your physical activity to avoid overheating and dehydration. You should also refrain from being active outdoors on overly hot or humid days.
Hi everyone, my name is Souha. I'm a student nurse in my second year at McGill University, and I'm working with CIME. So today I'm going to present the second part of nutrition during pregnancy. And I'm going to start with constipation, how to deal with constipation during pregnancy. Many women get constipated during pregnancy, and it happens because food passes through your body more slowly to allow to the fetus to get nutrients he needs. There's nothing like a good walk around the block to move things along, so it is not recommended to use laxative to treat constipation unless your doctor prescribes it to you in a severe case. If it's not walking, it could be eating food high in fibers like vegetables and fruit, whole grains. Drink prune juice; it's very high in fibers. Drink more fluids, especially warm and hot fluids. Be physically active is also important, and do not use laxative again. So next is prenatal supplements. Food is by far the best possible source of nutrients. Vitamins and supplements will never completely replace food. However, supplements are a good option to make sure you complement your diet and make sure you and your baby get all the nutrients you need for a healthy pregnancy. It is recommended to ask a physician what are the supplements that you need and avoid self-medication, because every woman is different and their need is different too. So some women will need more folic acid while others will need more iron, calcium, or vitamin D. But prenatal vitamins contain different nutrition from a brand to another. So you won't know what is best for you unless the doctor prescribes it to you. Getting an excess of iron can cause constipation as well. So having an excess of vitamins can cause unwanted effects on your body. So, best way to take vitamins and supplements. So you can take that's to improve the absorption. Take your vitamins on an empty stomach, taking vitamins with citrus fruit like orange, strawberries, tomatoes, melon, etc. Because these contain vitamin C, and vitamin C helps absorb the absorption of other vitamins. Don't take vitamins with milk, coffee, tea, eggs, and cheese. They decrease the absorption of vitamins. If you find that vitamins upset your stomach, then take them at bedtime. That will help with the digestion of vitamins. If you miss a dose of vitamin, please do not double up on the next day. It is about daily needs and not an overall intake. So if it's within the next 13 hours, then take your vitamins immediately. And if you forgot to take your vitamins after more than 13 hours, then just wait on the next day and take your regular daily dose. Next is gestational diabetes. So gestational diabetes is diabetes that start during pregnancy. But why some pregnant women have gestational diabetes? Insulin is a hormone that controls sugar levels in your blood. So pregnant women hormones are changing, and sometimes they can't handle the effect of pregnancy. If your body cannot produce enough insulin, then the amount of sugar in your blood will increase and create gestational diabetes. Risk factor for gestational diabetes include being 35 years old and older, previous gestational diabetes in previous pregnancies, being overweight, lack of physical activity, having a current fetus bigger than average. It is important to get screened. So all women should be screened for gestational diabetes at 24 and 28 weeks. If women are at risk of gestational diabetes, the factors that are mentioned here, then the risk factors that are mentioned here, then they should get screened at any stage of pregnancy just to make sure that they are healthy. And if you want to make sure that you are healthy without going to the physician, the doctor, then you can monitor your glucose level at Jean Coutu or Pharmaprix, or you can buy a glucose meter that you can use at home if you are able to. Next, so because gestational diabetes has no apparent clear symptoms, it is important to monitor blood glucose, especially for women at risk. So thirst and increased urination are possible symptoms, but can also be normal for pregnant women. So they are not clear symptoms. Most women see their blood glucose return to normal after pregnancy, but having gestational diabetes increases the risk of having diabetes type 2 after pregnancy. This is why it is important to keep monitoring after pregnancy. This can be avoided by being physically active and eating healthy. Most women will control their diabetes through diet and exercise, but only 20% will need insulin to control their diabetes. Of course, it is recommended to control without insulin and control it with diet. To control diet, you should avoid food that contains a lot of sugar, like juice and pastries. Eat moderate amount of whole food, bread, paste, rice, and cereal. Eat moderate amount of lean protein and healthy proteins. Fruit and vegetables are also very recommended. Also, I want to mention that monitoring blood glucose when controlling gestational diabetes with diet is extremely important. So you need to know what kind of food that raises your blood glucose to reduce it from your diet. And that will only be possible if you monitor closely your blood glucose. So now I'm going to do, it's like a little quiz just to cover some points that I covered earlier and make sure that you get these key information. So what is not a risk factor for gestational diabetes? You can pause this video and answer it yourself, but I'm going to give the answer for every question now, and you can pause and try to answer it yourself before having the answer. So what is not a risk factor for gestational diabetes? It is heredity. So heredity is not a clear risk factor. It is mostly due to environmental factor like overweight or physical activity or lack of physical activity. So gestational diabetes can be preventable with healthy lifestyle. Next, true or false, having gestational diabetes increases my risk of having diabetes type 2. The answer is true. According to Diabetes Canada, 5 to 20% of women with gestational diabetes develop diabetes type 2. So yes, you are at increased risk. Next is why it is recommended to take prenatal supplements with prescription. So the answer is 2. So every woman need is very different, and brand have also different composition of vitamins. So taking the wrong supplements will have no positive effect on your health, and it is useless. And it can even cause undesirable effects on your body like constipation. So even though you don't need prescription to buy prenatal vitamins, it is still highly recommended that you know which one is best for you. And last thing is when pregnant women should start taking folic acid supplements. So the answer is 2, at least 4 months before becoming pregnant. This is to prevent neurological diseases that occurs commonly in infants whose mother are deficient in folic acid. This is why it is important before conceiving your baby to start taking those folic acid supplements to reduce the risk of neurological diseases. So if it is an unexpected pregnancy and you didn't take folic acid supplements before, then do not stress. Chances are you don't need these supplements, especially if you have a healthy, balanced diet, then chances are you didn't need those supplements. And these are takeaway points about points that we covered, me and Naomi, in this presentation. And yeah, that's it. Thank you for listening to this video. Bye.